Today we have with us Dr. Rashmi Arasappa, Madam. She is the Assistant Professor of Psychiatry at the Department of Psychiatry in Mans. Last 2 days we have had expert talks on different aspects of mental health. Today, Madam will be delivering a talk on women's mental health during pregnancy. So, pregnancy, as we know, is a very transformative journey that not only involves physical changes but also significant emotional and mental adjustments, especially during pregnancy. Mental health is a crucial aspect of overall well-being for both expectant mother and developing baby. So this topic is very important. Before starting the talk, let me give a brief overview of Madam's academic achievements. As I told, she is an assistant professor of psychiatry at the Department of Psychiatry in Mans. She has done her MBBS from the very reputed Bangalore Medical College and then pursued her DPM and MD from Mans. She has been in teaching and research for a long time. She has worked as a senior research fellow in ICR project at NIMANS. Later, she has worked as program coordinator for Advanced Center for Yoga, then senior resident, Department of Psychiatry, again in NIMANS. Madam also has worked as assistant professor, Department of Psychiatry in the Dr. B.R. Ambedkar Medical College, Hospital, Bangalore. And later, since 9th October 2017, she has been working as assistant professor, Department of Psychiatry. Madam is a recipient of awards. A few of them are Dr. S.S. Jairam Award in 2008. Also, she has been awarded in the 41st Indian Psychiatric Conference held in South Zone in October 2008. And her main areas of research include depression, schizophrenia, yoga therapy in psychiatric disorders. She has published many research papers in national and international journals of repute. She is involved in 7 research projects, 5 of which are funded, including 4 in yoga therapy and 1 each in depression, schizophrenia, and COVID impact. She is also a co-guide for 7 MD dissertations, including 3 in yoga therapy and 1 each in depression, schizophrenia, somatoform disorder, and perinatal psychiatry. Madam is also a member of Indian Psychiatric Society. This very brief background, I request Madam to deliver her talk. Meanwhile, we have with us Dr. Bharat Srinivas. In fact, he has been instrumental in arranging this webinar. He kindly helped us contacting experts from NIMANS. This mental health series is a very important subject, and some have joined on Cisco WebEx, some on YouTube, and so those who could not join virtually for this particular talk, they will be seeing it later in the YouTube channel of KSTA. We will be uploading your talk on the YouTube channel. So once again, welcome to Dr. Bharat sir. Thank you for all your support and encouragement. This brief, I also welcome all the attendees both on Cisco WebEx and YouTube. Now over to you, madam, for your talk.
Thank you, sir, for that introduction. And at the outset, I would like to thank you for giving me an opportunity to speak in this platform. And I would like to thank Bharat sir also, for considering me for this topic. I will begin my topic. It's already late, so yeah. So today I would be talking about, as already sir has mentioned, about the pregnancy and the mental health issues during pregnancies. So as you all know, pregnancy, it's a very important life event in a female, where usually pregnancy is considered as, as a very joyful or a happiness movement. It is so in most of the, families or in the females, but for few of them, it might be a difficult period. So why it becomes difficult? Because of the, the worries associated with pregnancy, or some mental health issues that might be specifically seen during the pregnancy period. So as a, females are at risk of, having some mental health issues during pregnancy. This might be because a lot of physiological changes that happens in one's own body during pregnancy, where there will be a lot of hormonal changes or other chemical changes that happens, and there will be a lot of, stress during the psychosocial stressors during pregnancy, because I'll be talking about it later in within a few minutes. And also that, that lot of emotional changes also happens within the body. So during this becomes a vulnerable period in a female's lifespan, where they might be at risk, at a higher risk of having mental health issues compared to that of the males. Okay, so pregnancy, it's, as I told, it's a joyful and happy movement. But each one, every one of the of us might have some normal anxieties related to pregnancy. It is okay to have, worries related to pregnancy. It is common, but when it crosses a certain limit, and it does affect the female's functioning in her day-to-day life, that's when it becomes a important issue, and it needs to be identified so that it can be treated at the earliest. So what are the normal worries that a person, that a pregnant woman can have during her pregnancy? So women often worry about how they will cope with a pregnancy or having a baby. So why is this worry? So this is worry is related to the changes in her role. Like, she would be expected to become a mother, especially in when they are becoming pregnant for the first time. So they might have lot of worries related to the change in the role, that earlier she was just a wife or the daughter-in-law. Now the additional role of being a mother and being able to take care of the baby comes into picture. So that might be a worrisome for her. The she might have been going to a job, and she was doing well, a lot of freedom at that time. But once she becomes pregnant or after delivery, that she might have to stop going to work, which might, sort of worrisome for some females, for some women. And there would be a change in their relationships, um, you know relationships with the family, with the husband in-laws, or with the parents. Relationships in the sense, like how much time she can give for these relationship, how much time she can spend with the husband. So once the pregnancy starts, or once the baby is delivered, so she might have to spend more time with the baby and caring for the baby, rather than spending time with other family members. So her quality of relationship with the people might change, which might again become a worrisome thing for a pregnant lady. And also a doubt in herself, whether she will be able to take care of the baby well or not, or whether she'll be a good parent, whether will be able to play a good role as a mother. So that doubt comes, will I be able to do it or not? So that is one more worry that usually affects the pregnant ladies. And also the fear that there will be problems with the pregnancy or the baby. So whether the she will be able to complete the full 32 weeks, or whether the delivery will happen early, or will there be any pregnancy complications, or like bleeding, or she might have delivery early, premature or preterm labor she might have, or any physical health issues. Usually pregnancy is associated with some of the physical issues, as you all know. Like sometimes people might develop diabetes or hypertension or thyroid related problems. So will she have all these things because of her pregnancy? So that would be a worry for her. Or there might be a worries related to the baby, whether the baby will be healthy or not, whether normal delivery will happen, or will I have to get a LSCS done, it is an operation. So all, or baby, whether any problems with his organs or his physical health. So all this worries will start coming up in the pregnant mothers, pregnant ladies, and also the fear of childbirth. So probably there would be a fear related to the normal delivery that happens. So the pain that the person has to undergo during delivery, the whether it will happen or not. So there might be a fear related to childbirth itself. So what we call it as tocophobia. I'll be talking about it later in detail. And also whether also she would be worried like, okay, during this my period of pregnancy or after delivery, will I have a support which which I'm supposed to get, or will I be left alone? Will there be people to help me out? For example, during a normal period, she will be able to do everything, but because of pregnancy, she might get tired easily, or with a baby, taking care of the baby, she may not be able to do household work properly. So she might worry whether will she be able to handle all the stress alone, or will people be around to help me out with this? So all this worries, if it is at a milder level, it is okay. This is on the normal worries that the person, pregnant lady might have. But if the severity becomes a little bit more, where she is always preoccupied by this, not able to do her whatever routine work or the activities that she is supposed to do, then what it becomes the worrisome, and then we call it as a mental health related disorders that we would consider it as. So then they can manifest, see, usually pregnancy can be have different kind of mental health disorders, but today I'll be focusing more on the anxiety disorders and the depression. So, because these are the two most common, psychiatric disorders that you can see during pregnancy, there can be a variety of other, illnesses as well, like psychosis or eating disorder, or other exacerbation of any previous mental health disorders that they are having, that might worsen during her pregnancy because they would have stopped medications, or there might be worsening because of pregnancy itself. So there are a whole lot of mental health issues that can happen, but today I'll be focusing more mainly on the anxiety disorders and the depression per se. Okay. So when it comes to anxiety symptoms, so the anxiety disorder will have the different components of anxiety symptoms, where anxiety can manifest in the form of physically, like where they can have tremors of the hands or shakiness of the legs, difficulty in breathing. So these are all what is called as physical symptoms of anxiety. And there can be psychological symptoms. As I told, the worries related to the pregnancy, they might be become very worrisome, where they will be worrying about all those things that I'm telling from morning till evening. So these thoughts or the worries are called the psychological symptoms of anxiety. There can be a cognitive symptoms of anxiety, where the self confidence, or the thought that I will be able to go through the pregnancy and will be able to deliver a healthy baby will not be there. So their confidence would be very low. They would think that I may not be able to do anything. Something bad might happen. It might not go in a good way. So these are all the cognitive symptoms of anxiety. There can be an autonomic symptoms, where basically anxiety is because of the increased sympathetic tone of the nervous system. So because of the increased sympathetic nervous system, they can have increased heart rate, that racing of heart, and also the BP might be fluctuating, or either on higher side. And also there can be changes related to the body temperature. So these are called the autonomic symptoms of anxiety. So these are the cluster of symptoms that a person can have when the person is suffering from anxiety disorder. So this is a I got it from a Facebook of from the thing of the postpartum stress center. So here all the worries that the pregnant lady can have if she is having an anxiety disorder, like you can all see here, that I'm not sure how I am feeling. Like she's not sure about the feeling, the what she's feeling. She's feeling normal, or whether her mood is okay, or she's feeling sad or anxious or worried. It's become very confusing for her. It might be very overwhelming or very stressful or very anxiety provoking for her. and she might feel very regretful or confused whether she will be able to able to go through this pregnancy and end it with a good delivery of the baby, or she would think that what am I got into myself into a trap, will I be able to come out of it? So that kind of worry can be there. I might be freaking out. She might think like that. Or I might be obsessing about something I just ate and that I'm not sure I should have eaten. So it can be related to diet, whether I'm eating a proper diet or not. Is it good for the baby or not? I might be worried about the pain of the labor and all the horrid stories about the delivery. So the kind of treatment that they get, in the hospitals, also is a kind sort of worrisome for the ladies. They would have heard from their friends or relatives like how the process of labor would have been conducted to them, and if they had a bad experience, so the the pregnant ladies can start thinking about to themselves that they also might have such kind of difficulties during the labor. Or she might feel that I might need I might be thinking I can't do this mummy thing, that confidence will not be there. I might be worried I won't love my baby, so she feels that I may not be able to show care and affection towards my baby. Or she might feel I might be terrified that my baby is going to die, so she might be worried about the health of the baby, and she might think something bad will happen and the baby will die. Or she might feel that I might be sad about losing my old life, where the old life was had a lot of freedom, she could do as per her wish, but now having the responsibility of the baby, whether she will be able to get that much amount of freedom or not will be a worrisome for her. I might be exhausted from worrying so much or not sleeping. So she worries so much that she's not able to sleep. I might be wondering that if I am going to be a good mom. Again, whether she'll be a good parent or not. So when all these thoughts are too much and she's not able to distract herself from these thoughts, that's when that the person will need help, and they have to come for the psychiatric consultation. So these are the grouped into five components which I have explained just some time back. The pregnancy specific anxiety components consists of five components. Basically, fetal malformation, as I told, it's all related to the health of the baby. Means whether the baby's organs, whether it can be liver or any other heart or even the limbs or face, any kind of malform, means whether they will be developed in a proper manner or not, or worrying about the one's own physical appearance and health, like once they become pregnant, and then there will be a lot of physical changes that happens. So, and also there will be a lot of health issues, as I told earlier. So the worries might be related to these things. And also hospital related fear, fear of probably injections, or fear of getting infected, or fear of how they would be taken care, or waiting period in the hospital. So there can be a lot of fears associated with the hospital itself, or the delivery process, as I discussed earlier. Or the child care, means whether I'll be able to be a good parent or not, whether I'll be able to a good mother or not. So these are all the whatever the component symptoms that I described earlier, they all can be grouped under this five components, under what we call it as pregnancy specific anxiety. So the anxiety disorders differ from normative pregnancy related worry by virtue of their intensity. As I meant, intensity means the severity. See, mild worry here and there in a day, like for some time they think, and after they forget, and they are able to do all her daily activities, they are able to attend to their work, so that is okay. But if the intensity is so much that from morning till evening the only same thoughts comes, they don't bother about their eating, they don't bother about their sleep, not they are talking with their family members, not they are able to do their daily activities like bathing, brushing, or any kind of normal activities, if they are not able to do, that's when it becomes the anxiety disorder. So the intensity is basically the severity of the anxiety symptoms that the person might be having. The persistence, as I told, it has to be there for a certain number of period, like for few days or few weeks, continuously it has to be there. That is the persistence of the symptoms. It's not like one day she's worried and next 1 month or so she's okay, then you can't really call it as anxiety disorder. It has to be there for a continuously for few weeks or few days, then only it amounts for an disorder, anxiety disorder. Or it will have an effect, negative impact on the woman's functioning. So functioning can be in the form of her whatever occupation that she was doing as a housewife, doing the household activities, or if she's going out for a job, whether she is able to attend to the job or not, that becomes important. If she is not able to go for job or do her work because of this anxiety symptoms, then that means it is the severity is more and it is become a disorder rather than just the symptoms. Or it is affecting their biological functions. What we call it as biological functions, basically sleep. Means because of this worrisome thought, she is not able to sleep. Even though she is going able to sleep, she is getting up in between. So these kind of disturbances in the sleep is called as is also one of the criteria that has to be met for it to be called as anxiety disorder. Okay, so what is the prevalence? So how, to what extent that this anxiety disorders can be seen in a pregnant woman? So the self-reported anxiety symptoms amounts for about 18.2% in the first trimester, and about 19.1% in the second trimester, and 24.6% in the third trimester. So as you can see, as the trimester, as she progresses through the pregnancy, the anxiety is also, becoming more. But the prevalence actually varies from, study to study, but overall, this would be the picture. The overall prevalence of clinical diagnosis of any anxiety disorder is around 15.2%. However, the range can be between 5% to 40%. So who are all at risk of having this anxiety disorder? So the one of the primiparity means if the woman is becoming pregnant for the first time, where she don't have the experience of pregnancy and the caring for the child, so that's the risk factor. So, and also negative childbirth experiences. If she has delivered in the past, so if there has been any negative childbirth experiences, either during labor or related to health of the baby, so then it becomes a negative childbirth experiences. Or previous stillbirth in infant born less than 27 weeks. If the lady in the past would have delivered a dead baby, or if the baby was born before the 20 weeks of pregnancy, if she already had such deliveries in the past, then such ladies would be more vulnerable for having anxiety disorders. Or she has developed some medical complications during pregnancy, they also will be at risk. Or if some stressful situation is there during pregnancy, so it can be in the form of relationship issues with the husband or in-laws, or some issues related to dowry, or some financial stressor. Whatever stressor during pregnancy is always a risk factor for having anxiety disorder. And also if the baby in the past deliveries, if the baby was admitted to neonatal ICU, so that is also a risk factor. And if the lady has smoking, that is also again risk factor for anxiety to develop an anxiety disorder. So what happens if you don't treat anxiety? So if we think that lady is okay, doing well in her this thing, so let us leave. So it can't be done like that, because untreated anxiety during pregnancy is associated with increased risk of obstetric complication, such as the low birth weight. Means the baby born to a mother with anxiety might be of a lower weight, and they might have a preterm labor. Means before the maturity itself, she can have a delivery. Or small for gestational age, again it's similar to the low birth weight. And small head circumference, the baby might be very small, which may not be so healthy compared to the babies born to the healthy mother. And if there is also an association, but it's inconsistent, between the anxiety and the lady developing an medical condition called as preeclampsia, where she will have higher BP and also might be at risk of having seizures at that time during the pregnancy. And also there can be a increased rates of cesarean delivery and the after the birth the health of the baby might be lower, as some indicated by the Apgar score that we usually do the assessment of the health of the baby after the delivery. So anxiety in pregnancy has been found to be a strong predictor for the postnatal depression. Means if the person is having anxiety during pregnancy, they might be having a higher risk of developing depression after the delivery. So that's why it becomes important for us to treat anxiety once we detect in the pregnancy period. So what I was talking about is tocophobia, that is the fear of childbirth. The fear of childbirth is common and more intense in pregnant and nulliparous women. That is the person who have not had become pregnant, nulliparous woman, than in the pregnant a woman. Means before the pregnancy itself, the lady might be start worrying about the childbirth. And over 20% of pregnant women report fear, and 6 describe a fear that is disabling. Tocophobia has been classified as follows, that is secondary and primary. The secondary is if there is a previous deliveries which has traumatic deliveries, secondary to that they might develop, or primary which develops in the the lady who has not yet become pregnant in the past. So pregnancy are secondary to depressive illness in pregnancy. So we need to assess about related to the anxiety. So these are the mainly we need to collect the history related to her, the sleep, that is what is insomnia, or intrusive and frightening thoughts. So we need to assess the thoughts in that woman so that we can get the symptoms of anxiety. Or if you want to use the scales, there are certain scales, GAD-7 and perinatal anxiety screening scale and Edinburgh's postnatal depression scale. The component, the anxiety subcomponent of this scale can be used for the assessment. And assessment has to be throughout the pregnancy because anxiety can develop at any stage. It's not like once you screen and leave. It is not like that. It has to be done periodically to identify. And there is a high chance that whenever a person has anxiety, the person might have depression as well. So depression and anxiety can coexist in about 30 to 58% of patients with major depressive disorder. And in perinatal period, it is seen in about 2 to 13% of women. And comorbid anxiety and depression symptoms have been reported to have a longer, more severe, and more refractory to treatment. Means if they have both the disorders together, the disorder might last for longer period. It might be of very severe degree, and it might not respond to the treatment given. So now moving on to depression. So the common symptoms of depression in the pregnancy is like, as we know, the depression in common is like the person will be feeling very low, feels like crying most of the times, becomes very sensitive, and they may not be interested in doing their work or whatever hobbies that they were interested earlier. It might not be sounding very interesting for them. They might stop talking to people. There might be disturbances in their sleep and eating, and there might be a lot of negative thoughts, that feeling that they are worthless, and it's better that they die rather than lead this life. So these are the symptoms of depression in general, but there is a difference how it can manifest in pregnancy. So in pregnant women, it can be seen as sadness or frequent crying spells, uh, and exhaustion. They feel tired very easily. First of all, the pregnancy itself can, as the pregnancy progresses, there will be tiredness, but this tiredness will be more than that normal tiredness seen during the pregnancy. And they feel disconnected from their baby. Like, they may not feel so much emotionally attached to the baby fetus inside, and they might feel very restless. They can't sit in one place. They'll be very, walking around here and there, and trouble remembering things. They have difficulty in focusing or concentrating on a particular thing, so which will affect them to register the things, and in turn is manifest in the form of they may not be able to remember the things well. and not being hungry and or eating more than usual. Usually pregnancy means there will be a increase in the hunger level because of the demand by the fetus, by the baby. But here, if the pregnant lady is having depression, then she might not be interested in eating at all. The hunger levels will be less, and she might get angry very easily, very irritable very easily for small small things also, that she might get angry. And she gets frustrated, and she might start arguing with the family members. And there can be agitation. That restlessness and anxiety together makes up agitation. And as I already told, like she can have trouble sleeping. Means there can she gets sleep very late, or gets up very early in the and in between when sleeping, or she might get up very early in the morning. Or the opposite of it, that they might be sleeping too much. So this also can be seen. So these are the common symptoms of depression in pregnancy. So what is the prevalence? So antepartum is nothing but during the pregnancy, the depression seen during the pregnancy. It's been seen at around 15.5% in the early and the mid pregnancy, and it might come up to, reduce to about 11.1% in the third trimester. And high income countries. There is a difference between the prevalence of the depression in the high income countries and the low income countries. So in the low income countries, the prevalence can be around 15.6%. Yeah. So same thing, high income countries, it's about 7 to 15%, whereas in low and middle income countries, it's between 19 to 25%. And so again, it's not like all the pregnant ladies with the stressor, or some small problems in their life, that they become depressed. So these are the factors which might play a very important role in causing depression in the pregnant woman. So in single marital status, like either the husband is not there or not supportive, or when the pregnancy is because of some rape or some sexual abuse. So that is what is called a single marital status. So that poses an increased risk on the female for developing depression. And the woman from low social economic status. And if there is a recent stressful life events, either loss of some family member, or some relationship issues, so anything of that is also a risk factor for having a depression. If it is an unplanned pregnancy, so the family might be going through a lot of stressful situations, and they are not planned for the pregnancy. So at that time also it can be a risk. Or if the mother herself would have had some childhood trauma, like some difficulties that she would have gone through during childhood, so that is also can be a risk factor. That is called as childhood trauma. Past year intimate partner violence means if there is a problem with the husband, where husband there's a lot of domestic violence in the family, where husband sort of beats the woman, or abuses her even emotionally. So such female also will be at risk of developing depression. Unemployment, if the lady is not employed, or if they are from rural background, and the pregnancy is through assisted reproductive techniques, like if they have used the IVF techniques for becoming pregnant, so that time also it can be a risk for depression. And marital dissatisfaction, so if there is a problem in relationship with the husband or the in-laws, so that is also an important factor for women to develop depression. So what happens if the depression is not treated? So it can have negative health related behaviors and adverse outcomes. So because of the depression, that the lady might not be interested in eating well, so that might lead to poor nutrition, and that in turn might affect the health of the baby also. Because of depression, to feel better, so they may start using alcohol or some other drugs to feel better. So there can be an increased risk of substance abuse. And also inadequate prenatal care means they, because of depression, they're not interested in doing anything, so they may not visit the go for the regular antenatal checkups. So again, that injections or the tablets that they're supplements that they're supposed to take, they may not be able to do. And it can also be a risk factor for preeclampsia. It's a medical condition, as I told, which might involve having a high blood pressure and seizure. and the baby might be born with a very low weight. Or it can, as I told, related to the anxiety also, the preterm delivery, like the baby might be born before the maturation of the baby. And there can be, this is also one of the risk factors for the lady to develop the depression after the delivery. And if the severity of the depression is very high, then it can lead to the suicide of the mother. And sometimes, they might have a harmful thoughts related to the fetus, to the baby as well. So these are all the risk factors. So that is the reason that it becomes important that we identify it and then treat it early. So it can be of different variety, this types of depression. So the minor, where it is subsyndromal symptoms, cause some degree of depression. Means some depressive symptoms here and there, it is there, but she is able to manage well. So that becomes minor. It is mild when there is a low mood, depressive cognitions, and functioning is fairly preserved. It becomes moderate severity, where there is a impaired functioning and childcare. So functioning can be in terms of her own household activities, or related to her sleep. That's what comes. The next is biological functioning, and there also wish to die, and there is a thoughts of harming the child as well. So that becomes moderate. The severe is where there is a thought of harming themselves, and even sometimes harming the uh, a baby as well. And there are other symptoms of catatonia, agitation, and psychosis. So how do we identify the depression? So as I already told, through clinically, by asking, talking to the patient, checking for the symptoms. And there are also scales where Edinburgh postnatal depression scale can also be used, and PHQ, that is patient health questionnaire, is there, and postpartum depression screening scale is also there. So which can be used for assessment, and it has to be done periodically throughout the pregnancy. So these are the few blood tests that has to be done to check the physical health of the mother, because sometimes impaired physical health itself can have an effect on the on the physical psychological health. For example, if the patient is having anemia, or if thyroid problems are there, that in itself will be a risk factor for having depression. So that's why complete blood counts and hemoglobin, ESR, peripheral smear, blood sugar, renal and liver function test, serum electrolytes, thyroid function test, CT of the brain, plain and contrast if it is required. If some neurological symptoms are there, then we have to get it done. Blood and urine cultures if the mother is infected. If there is a need, then we can get these things done. So these are all the assessment. So management on the whole involves, first of all, identifying it, assessing how severe it is, and then handling it through counseling or the therapy. See, usually pregnancy means the baby will be there, and if we are giving the tablets to the mother, obviously that will have an effect on the baby also. So the first step, if the severity, if the illness is of a milder variety, so the first line of management would be counseling or therapy, where she will talk to a psychologist or any other treating member, and would undergo individual therapy or counseling. If the severity is or more higher, like as I told, moderate or severe, or if it is therapy has not helped her, counseling has not helped her, then we will think of medications, which can be in the form of anti-anxiety or antidepressant medications, and we will try to choose the medications which are safer during pregnancy, because once she takes, definitely the baby will also be affected. So we'll try to choose the tablets which are safer. And obviously these both things should be combined, always combined with lifestyle modifications, which involves a lot of physical activity, which can be in the form of walk, simple walk, or simple exercises, or simple yogasanas, or even the breathing exercises. So these lifestyle management, and the diet as well, and the sleep patterns, so good sleep hygiene. So all these things have to be sort of followed for the lady to come out of depression or anxiety. So yeah. So I would like to conclude that anxiety and depression is common in pregnancy. See, we know about postpartum blues, the sunny what we see in the after delivery, but we don't give that much of importance for the pregnant ladies. We somehow feel that pregnancy is a protective factor, so nothing will happen to the pregnant woman. This is kind of a myth. We need to always look for any mental health issues in the pregnant lady as well. And then if it is identified early, it can be treated early and it can have a good benefit out of it. So always, if anybody is in trouble, we need to see whether she needs a psychiatric consultation or it can be sorted out, um, you know within the family, or if some issues are there. So yeah, but it's important to identify, and then if it is identified, and it's very important to treat, because it's definitely going to have an effect on the mother's health and the baby's health as well. Thank you.
Thank you, madam. Very, very informative, insightful, and scintillating talk on pregnancy and mental health. We are thankful. From your talk, we could get the point that recognizing and addressing mental health needs during pregnancy is a very proactive step towards ensuring the holistic health of both mother and child, fostering a positive start of the parenting journey. So it's a very, very important topic to give a very good overview of pregnancy and mental health. On behalf of PSTA and all the attendees who have joined on both Cisco WebEx and YouTube, we are very grateful to you, madam. I am also thankful to Dr. Bharat sir. Umesh, are there any questions?
No, sir. As of now, there are no questions, both in
There are
YouTube
few
and
questions there, madam. There are few common questions.
Yes, sir.
What role do hormones play in affecting mental health during pregnancy, and how can this be understood and addressed?
Yeah, that's a very important question, because lot of that emotional changes that happens in pregnancy is because of the hormonal changes itself. Like, the level of the progesterone becomes more and the estrogen comes down. So, and the ratio between the two, varies. So, and that itself is a cause for a lot of, the symptoms that the anxiety, especially anxiety and depression that the woman develops, might be because of that. But being said that, we really can't give a hormone for that. Probably we need to sort of address the psychiatric symptoms, look at, talk to them, see what is the difficulties that they are having, what is the severity of symptoms that they are having. We need to see how we can sort of help them out with that.
Madam, one more question.
Yes, sir.
Are there particular periods during pregnancy when mental health concerns may be more pronounced, and why?
Like as I told, a few of the studies have shown that, first trimester and the third trimester are the risky period. Middle one is okay, but it's again not very consistent. So the symptoms can happen during any time of the pregnancy. Trimester should not matter, but usually they tell that first trimester, since because it is the starting, and also just before the delivery, that lot of anxiety symptoms and depression also can be seen, sir.
Thank you, madam. Now we have with us Dr. Bharat Srinivas sir. Sir, over to you for your kind comments.
Yes, no, no comments except that I want to congratulate Dr. Rashmi for making it so simple, so that it reaches all kinds of audience rather than making it too technical. So she has made it simple so that the message could be received, and this kind of topic requires a lot of publicity because awareness is limited. And I had the opportunity to also work with Madam while we were developing some educational videos on women's mental health.
Yes.
So today her talk was very good, and I hope more and more people will benefit out of such programs.
Yes.
Thank you, Dr. Rashmi. Thank you.
Thank you, sir. I again would like to thank both of you for giving me an opportunity, and then hope to have some more talks like this. Yes. Thank you,
Now
sir.
we will
Thank
have
you.
some physical talk in our KSTA. We'll
Yes,
organize
sir.
a workshop or a training program so
Okay.
that it will be better rather than having only online talks. It will
Yes,
be
sir.
better to have physical meet. We'll arrange one in maybe in March or April, madam. Thank
Sure,
you
sir.
very much for your
Thank you,
time.
sir.
As Bharat sir told, you made it very simple. Even a non-biologist could understand very easily. Thank you very much.
Thank you, sir. Thank you very much.
Also thank all the audience who have joined on Cisco WebEx and YouTube. Tomorrow, one more talk by an expert from Nimas, Dr. Sundar Nag, will be delivering a talk on mental health of young mothers. I request all the audience to join within 3 o'clock. We will have one more exciting talk on mental health issues. Madam, thank you very much.
Thank you, sir. Thank you.